Morning, Dr. McHenry coming to you December 10th, Thursday, for another COVID update. Today is the day, by the end of the day, that Pfizer will hopefully receive approval by the FDA for their current vaccine for COVID. It is a two-stage vaccine, meaning you will get two vaccinations to get the best chance at immunity. It is an RNA-based vaccination. It will be going out to those at highest risk. As per Governor Ducey here in our state, that includes nursing homes, hospitalized patients, the elderly, first responders, nurses, doctors, policemen, firefighters, and teachers. Unfortunately, the numbers of doses that were going to be available initially are much lower than predicted. So as for healthy, lower risk patients such as myself, I don't see vaccinations being available probably till much later in the spring. I can't promise one way or the other, but that's the trend that it's looking like. I do not know if and when our office will receive vaccines. The plan is for all doctors' offices to receive vaccinations for their patients, but I see this coming much later in spring towards summer if they are provided to offices such as mine. We will continue to update you on the vaccination supply and availability and locations, etc. That being said, COVID is rapidly spreading around our community. As per the ASU Biodesigns trending, the percent positive was upwards of 30% as of yesterday. That means 30% of people testing are positive. That doesn't mean 30% are sick. That means 30% are carrying the virus. That being said, 1 out of 3 people you see may be a positive. With that, you should be extra careful out there in crowds, in locations where you might be exposed. So to continue to follow our previous recommendations on mitigating spread. Also, as far as office policy, we like to keep anyone who is COVID positive, COVID suspicious, COVID exposed outside of the office. That protects me, that protects the staff, and keeps the office available for everybody to continue to seek treatment and ongoing care for their other medical conditions. If you think you've been exposed, if you have been exposed, we ask that you don't come into the office, but that you call. We will meet you outside. We will test you from your car. We will manage you. I will talk to you over the phone. We will discuss treatment options. I've been able to keep many patients, actually all of my patients, outside of the hospital as far as COVID goes. I've had some very high-risk patients become positive and have fairly significant symptoms, but we've been able to manage those as outpatients. If you are in close contact with me and we monitor your symptoms appropriately, we should be able to keep you at home throughout your COVID infection if you become symptomatic. The majority of people will have minimal to low symptoms with COVID, and they will recover. So that being said, my goal is to keep all of my patients outside of the hospital and treat them as outpatients. That requires close communication with me and alerting me of any known exposures. With that being said, I wish you all, and if I don't talk to you before, happy holidays, and I look for a much better 2021 to come.